Dr. Mohsina Najib, Senior Clinical Psychologist. I would also request you, Madam, kindly join us on stage. Professor Dr. Rafia Rafiq, Madam, kindly join us on stage. Professor Emeritus, IAP, Vice Chancellor of Noor University. I'm so sorry. I'm so sorry. Okay. I apologize for this. Okay. So, Professor Dr. Amina Mozam, Madam, kindly join us on stage. Dr. Afifa Anjum, kindly join us on stage. Professor Dr. Zainab Zadeh, kindly join us on stage. Thank you so much, Dr. Madeeha, for joining us. Our first keynote speaker of second round of this session is Professor Dr. Madeeha Malik. She is the first and only female professor of pharmacy practice in Pakistan. Recently, she got her contract research organization, CRO, registered with DRAP with the name of Syntax Health Projects and is the CEO of her company. Her company is also registered with SECP and she has launched her organic skincare line and cosmetics. She is one of the prominent female researcher, academician, and the entrepreneur of Pakistan. She is extensively involved in community work and is heading two community awareness initiatives, CEDI, that is Community Awareness Eating Disorder Initiative, and MICA, MICA, Mental Health Community Awareness Initiative. Thank you so much, Professor Dr. Madeeha, to join us. Over to you.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. I hope everyone is fine. First of all, thank you so much for providing me with this opportunity to give this presentation. Actually, I wanted to join in person and I especially came to Lahore for this, but somehow I was not feeling well. So I could not join all of you in person, but I hope that probably I can share what sort of contributions in our humble capacity we are contributing to Pakistan. And if any one of you would like to join us, so you're more than welcome to basically join. My name is Professor Dr. Madeeha Malik, and I am the CEO of Syntax Health Project, and I'm also the president of Eating Disorder Association of Pakistan. That is basically affiliate association.
Dr. Madeeha, can you please check your mic?
Sorry.
आपकी आवाज काफी कम आ रही है. Can you please speak again?
Yeah, sure. Now you can hear me, Aisha?
Yes, it's much better. Thank you.
Okay, thank you, Aisha. So I'm also the president of Eating Disorder Association of Pakistan, ADAP. ADAP is also the affiliate organization and a partner association for Academy of Eating Disorders USA. And we have been doing certain collaborative researches with them in Pakistan to produce evidence-based data. And that this is one of the research with the name Impact of Educational Intervention, a pharmacist on assessment of knowledge, attitude, behaviors, and screening of eating disorder among adolescents in Pakistan. So probably I would be sharing the results with you. Okay. If we talk about the alarming statistics of eating disorder, 9% of the total population is affected by eating disorder. And the incidence of eating disorder is increased by 15.3% during COVID-19, which is quite alarming. And 70 million people globally live with eating disorder. And with eating disorder treatment, 60% of the patients can make a full recovery. However, only 1 in 10 people with an eating disorder will seek and receive treatment. So if you look at the people with physical disabilities, they are more likely to develop eating disorders, and similarly 20 to 30% of adults with eating disorders also have autism. This is something very, I think, interesting fact which needs to be considered when we are designing different therapies for the children. Eating disorders may affect between 5 to 8% of the women during pregnancy, and Asian American college students reported higher level of body dissatisfaction and negative attitude towards obesity than their non-Asian peers. As you all know that it is very common, body shaming, bullying, and this sort of thing. These sorts of things are very common in Asian culture. When we were looking at the evidence-based data, because currently we are also in the process of designing clinical trials on eating disorder in Pakistan. So we were looking at what kind of and how many randomized clinical trials on eating disorder have been conducted globally. So we found that there were 13 randomized RCTs which have been done in America, 14 in Europe, 7 in Western Pacific, 8 in Southeast Asia, and 0 in Africa and East Mediterranean region. So this was something like, being a so important public health concern and keeping in view the rising prevalence and incidence of eating disorder, especially in Southeast Asia, we could not find a single clinical trial which was focused mainly on eating disorder in Pakistan. So there were different types of eating disorders that were studied in these trials. 16 trials were purely conducted on binge eating disorder, 5 on anorexia, 1 on body dysmorphia, 1 on muscle dysmorphia, 1 on binge and bulimia, and all the 14 were basically involving all types of eating. What we actually identified some interesting findings from these trials. Basically, we performed a systematic analysis review based on PRISMA guidelines, and some interesting findings which we identified from these trials were that brief strategic therapy is the clinically more effective than CBT in treating BED, promoting weight loss and improving global functioning among women with BED and comorbid obesity. And treatment of 8 weeks with sertraline resulted in significant improvement in the binge eating scale score, leading to significant weight loss. And we also found that the implementation of a dial electrical based therapy, DBT, which is the new type of therapy most commonly promoted in Western world these days, informed day hospital program with integration of family based therapy is associated with improved patient outcomes. So now, talking about the scenario in Pakistan, according to WHO, 23% of the entire population of Pakistan is clinically obese. And 16% of the children in this age range are now obese. That equals 10 million children in Pakistan. And if you look at the proportion of youth in Pakistan, it is maximum in the age group of 10 to 24 years. And if we talk about 1 in 4 adults are considered as obese in Pakistan. And we rank according to national obesity risk 6.5 out of 10, that is at moderate risk. And if we talk about the rate of increase in adult obesity in the 2 decades, like from 1995 to 2015, it is 5.9% among men and 4.6% among women. And if we look at that, what we are gonna, Pakistan is going to meet UN adult obesity targets for 2025. So 0%, that is very poor chances that we would be able to control this pandemic. I say it as the pandemic obesity now, because according to statistics, Pakistan ranked 9 out of 188 countries in obesity in the world. So if you look at 2010 and now the predicted prevalent incidence in 2025, you can see that it was 4.5% in 2010, which is expected to increase to 10.6% in 2025 among men and 9.1% among women, and it is expected to increase to 17.3% in 2025. While as far as the children in the age group of 5 to 19 years are concerned, it was 1.8% in 2010, and now it is expected that it would be 6.2% in 2025. So when we were actually studying this topic, and we were like very much interested that how these eating disorder are going to affect, like the population of Pakistan, especially the adolescents and the youth. So we found out that usually eating disorders are very common among Pakistani adolescents, but it is usually under-diagnosed or untreated and misunderstood due to the lack of knowledge and awareness. And weight and body appearance, actually, it is what which are seen as the taboo, social taboos in the countries. And we do not have any specialized services for management of ED with unavailability of experts, and limited research data is definitely available on the issue of ED. So we believe that early detection and evidence-based therapy treatment strategies, interventions can help patients to recover at the initial stages. And we really would like that, uh, as Pakistan healthcare workforce, we have very inadequate healthcare workforce for our population. So I think pharmacists, clinical psychologists, and clinical nurses, pharmacologists, such kind of people should come forward and form a team, and they should be involved in this early detection and screening. So we designed an intervention study, and we wanted to see the impact of educational intervention by pharmacists. The team was mainly led by pharmacists, but it included clinical psychologists, a psychiatrist, a doctor, and a nurse. So we wanted to see that how the intervention can impact on the cap and screening of eating disorder among adolescents in Pakistan. So it was a quasi experimental single-blinded study design, which was performed on the age group of adolescents between the age of 13 to 17 years. And they were able to read and understand English to answer the questionnaire. Our respondent, we picked like 382 respondents from, from a school that was in Mirpur and in Islamabad. And we also did the cross comparisons for that. We use different validated tools like SCORF, EDQ, CIE, and STY for this. And then we designed a CBT activity whole program with the help of AED, that is American Association for Eating Disorder, and also involving clinical psychologists and psychiatrists for this. And then we did the trainings, and then we executed this intervention study on the students. And after that, after 2 months of intervention, we actually collected post-data intervention, and then we analyzed the data. So basically, if I would just quickly talk about designing and implementation of the intervention. The baseline activities were developed by AED and pharmacists with a module named Healthy Body and Mind. And then it was based on improving ED knowledge and awareness along with CBT activities. And all these activities, what we actually wanted that at the end of this intervention, the adolescents should feel good about their body image. They would be accepting more about their body, and they would be having some body positivity changes among them. And as along with improved knowledge for eating disorder. So we did that, and I would like to share few of the result of this long study with you. If you look at this results, the knowledge of the adolescents regarding ED improved from 43% to 90 to 96%. And there was a positive attitude which ranged from 34% to 66% after the interventions. And their behavior also had a change, like that of there was a positive change from 32% score to 62% score. And when we performed Wilcoxon test on them, we also identified that there was a significant difference among the knowledge, the body acceptance, and the anxiety trait states. So the key findings were that the knowledge of adolescents about different types of eating disorders, such as anorexia nervosa, bulimia nervosa, and binge eating disorder, improved after the intervention. And the attitude and behavior also improved post-intervention as they started feeling like satisfied. They had no influence of weight, and they stopped avoiding food and dieting behavior to some extent. I don't say that it was 100%, but it was very miraculously, it was very, the change in the behavior was very positive. And one of the things which we actually identified during this study was that, like, social media had a very, negative kind of impact on them. Like, they wanted to look like some influencer or some, public figure who is very ideal in the form of the body image for them. And the anxiety levels of the adolescents also reduced after interventions along with the probing factors. And they started feeling calm, secure, satisfied, and stopped worrying post 2 months of intervention. So based on the results of this study, We actually worked with US Embassy. I'm also working as a consultant for US Embassy, and I'm also the alumni exchange for the US alumni exchange program. So we actually shared these results with the US Embassy, and I also won the funding for this. And then we launched this app. That is the first, you can say, app of body positivity and eating disorder screening for in Pakistan, and it is available in the Google Play Store with the name I Matter. You can just, download the app and you just enjoy the different activities, and you will enjoy it, and you will not, you will even not be, knowing that so much of your stress would be gone. So this app actually includes different screening tools for ED and different CBD activities. And what we did was actually we took all the successful interventions and the activity which has already been conducted by NIDA. That is one of the another very prominent eating disorder association of and BEATS of UK, and one of the US, that is AED. And we just modified them according to our culture. Like, they had this activity, I own myself. So we converted it to main hoon na, like main hoon. And then there was another activity with the name Let's Make a Difference. And then we converted it to Zara Hatke. And, it's a very positive kind of engagement in these different activities. And when you play these activities, you even do not realize that this is something which is basically increasing your resilience and coping strategies, and it is giving a very positive impact on your attitude and behavior towards your body acceptance. So that's what we feel, that together we can combat eating disorders and break the stereotypes together. Thank you very much for your patience, listening. And if you have any questions, I'm more than